Guys, in this video, let us cover supra-infections or super-infections. Both are same, okay? In the exam, it has been asked, so please focus here. Supra-infections or super-infections. What are these, okay? After antimicrobial therapy or because of antimicrobial therapy, new infection, if it develops, then it is called as supra-infection or super-infection. Is this clear? Basics are clear, correct? Because of antimicrobial therapy, new infection develops. How can this happen? Yes, because the antimicrobial therapy or antimicrobial agent, they are going to alter the normal microbial flora of the body. Alteration in normal microbial flora, okay, of the body. These normal flora, actually they were contributing to the host defense, to our defense it was helping. How? By producing bacteriocins which will inhibit pathogenic organisms. Now when the organisms, these organisms are going to be killed by the antimicrobial therapy, pathogenic organisms can grow. Interesting, right? The bacteria in our body is actually helping us and protecting us from the attack of these pathogenic organisms. Really, really nice. Okay. Now what will happen? The pathogenic bacteria, organisms, they will have no competition. Because all the antimicrobial therapy has destroyed the normal flora. So pathogenic organisms have no competition and they get access to all the nutrients and the sites, everything. Fine. It can happen that within the normal microbial flora, some microbial flora die and some microbial flora are able to get access to all the nutrients and then they themselves become pathogenic, okay? Did you understand? Just read this line. Let me get you a wake-up call. So what are we studying? We are studying supra-infections or super-infections. See how all of these bacteria are looking so mad. Okay, so you understood something, right? Now let's move on. This usually happens when you use broad spectrum. That's why, you know, they say in resistance also don't use broad spectrum antibiotics. Okay. Broad spectrum antibiotics will lead to supra-infections. Okay. Example for broad spectrum will be tetracyclines, chloramphenicol, etc. Fine. I'm moving some sentences are there here and there in the textbook. I'm leaving those, okay. I think you can read those from the textbook yourself. Now moving on to conditions that are predisposing to supra-infections. That is, they are more common when such situations are there. Like if a person is on corticosteroid therapy, if the person has HIV, AIDS, if the person has diabetes, if the person has disseminated lupus erythematosus, right? Disseminated lupus erythematosus. If the person has leukemia, malignancies, right? If the person is on anti-cancer drugs, if the person has decreased WBC count. Okay. So I think it's clear, right? Conditions predisposing to supra-infections. Now what are the sites of supra-infection? Let's quickly look at supra-infection sites. Supra-infection sites are like the oropharynx, intestine, respiratory tract, genitourinary tract, occasionally skin. So basically anywhere that is normal commensals were there you will have the supra-infection. The sites will actually be sites of normal flora, like oropharynx, intestine, respiratory tract, genitourinary tract, and sometimes skin. Okay, sites are done now. Let's move on. Supra infections are generally more difficult to treat. Okay, so they are really difficult to treat. Let's add that in the initial information. A new infection develops, difficult to treat. Okay, it is difficult to treat a supra infection. Now let us go to examples. In examples, we are looking at three combinations: an organism that is going to come and infect, the manifestations that will be there, and how we can treat. Now, Candida albicans is a very, very good example of a supra infection. Candida albicans is actually fungi. It will cause diarrhea, thrush, vaginitis, vulvovaginitis. So you can treat it with nystatin or clotrimazole. Staphylococcus also can invade. Then you will have enteritis. Then you can treat with cloxacin or vancomycin, or if it is resistant to vancomycin, linezolid. Fine. Then Clostridium difficile. Clostridium difficile also becomes a supra infection. So this is the Clostridium difficile. It is associated. It will cause, what will it cause? It produces an enterotoxin which damages the gut and mucosa, forming plaques. Let me make this. It produces enterotoxin which damages gut and mucosa and it forms plaques. Metronidazole, vancomycin are the drugs of choice. Okay. Next you have Proteus. Proteus is also a bacteria. It causes urinary tract infection, enteritis. You can treat it with cephalosporin or gentamicin. Now let's move on to the next one, Pseudomonas. Pseudomonas also can cause supra infection. It is going to create urinary tract infection, enteritis, same as Proteus, right? Remember, Proteus also, they've written the same thing. And to treat Pseudomonas, you can use the Pseudomonas. You remember, it is aerobic. It is aerobic, correct? So you can use ceftazidime, gentamicin, etc. Okay. So those were the supra infection examples. Proteus, Clostridium difficile starts here. Candida albicans, Staphylococci, Candida, Staphylococci, Clostridium difficile, right? Clostridium difficile. Then Proteus. Then last one, Pseudomonas. These are the examples given in your textbook. Moving on. How to minimize supra infections. How to minimize supra infections. So you should use narrow spectrum antibiotics. Same like drug resistance, right? Use narrow spectrum. Don't use antimicrobials to treat trivial, self-limiting or untreatable viral infections. Basically, what they are saying is, if it is trivial issue, don't give. If it is self-limiting, don't use, because self-limiting, usually in viral conditions, it will be self-limiting. So don't, if it is anyways going to limit itself, you can avoid using antimicrobial treatment. Remember, antibiotic as such can be given for bacterial or viral. Okay. So basically, you can give for against virus, against bacteria, against fungi, against helminths, against what else? One more was there, right? Protozoal. Okay. So last one here, do not unnecessarily prolong antimicrobial therapy. Don't prolong. Okay. Don't give inadequately also, don't prolong also, basically. Okay, let's revise now. Supra infections or super infections. I think, yeah, this is the starting slide for supra infections or super infections. Because of antimicrobial therapy, new infection develops, which is difficult to treat. Because normal microbial flora, they get altered, because of which the host defense gets compromised. And pathogenic organisms have no competition. They have access to all the nutrients. Some non-pathogenic component of flora also can turn into pathogenic kind because of the lack of competition. Broad spectrum antibiotics or broad spectrum antimicrobial agents, usually they lead to supra-infections because they're going to kill variety of bacteria. Example, tetracycline, chloramphenicol, they can lead to supra-infections. Conditions predisposing to supra-infections. In some people, if they are already immunocompromised, then supra-infections can develop very, very fast. Corticosteroid therapy, if they have AIDS, if they have diabetes, if they have disseminated lupus erythematosus, if they have leukemia, if they have malignancy, they are all predisposed to supra-infection. Anti-cancer drugs, if they are on, because they have decreased immune and a decreased WBC count. Supra-infection sites, these are nothing but the sites of normal flora. The sites are nothing but the sites of normal flora. Examples, you have the oropharynx, respiratory tract, genitourinary tract, intestine, sometimes skin. Now let us look at the examples of supra-infections, the organism, manifestation and the treatment. Let us look at the organisms now in the division. Candida albicans, Staphylococci, Clostridium difficile, Proteus and Pseudomonas. How will you prevent or minimize supra-infection? You will use narrow spectrum antimicrobial agents. Don't use broad spectrum. Do not use AMAs for self-limiting diseases or trivial cases. Do not unnecessarily prolong the therapy. Okay. So that's all for now in the supra-infections video. Bye bye.